Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live right now on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. I'm live in studio. It's beautiful outside. You should get out and play. Only after you listen to the program. Broadcasting to you from 105.9 FM and AM 630 WMAL. We're here to answer your questions on any type of healthcare problem that you've had from a natural point of view. Perhaps you've had a problem, you've tried, you've applied, you've searched high and low, and you've come up with the same old, same old. Nothing that really works. Well, we have an opportunity for you. Give us a call, 888-630-9625. That's 888-630-WMAL. Talk about anything that you'd like to talk about. We're going to talk about arthritis. You know, that thing that everybody tells you have to live with for the rest of your life, and that there's no outcome, just worsening, that inflammatory reaction, the joints that don't work anymore, the knuckles that get big, the joints that twist. All those things are arthritic-like type of symptoms. Or you just simply go to the doc and you say, listen, I'm hurting, and subsequently, you know, when he can't find anything else, he says, well, you must have arthritis. And many of you say, okay, and then you start taking all kinds of drugs because nobody else can come up with the answer. And you're stuck. Well, there are many different types of arthritis. If you go into Dorland's Medical Dictionary and you look up arthritic conditions, you're going to see literally between the subsets and the main types, you're going to see tons of them, meaning dozens. And it's really a scary situation. But here in studio, to help me get through it, to talk about it, and also to present to you this Wednesday evening at the Roselle Center for Healing, your host, your presenter, Dr. Leonard Poe. Dr. Poe.
Yes.
Yes. We are going to talk about a very crippling type of problem.
It is.
It is.
Unfortunately.
I know. So, from a chiropractic point of view, from a chiropractic applied kinesiological point of view, we have a propensity to ask a question, why is that? Why things happen? But before you ask that question, you really have to define what arthritis is. So why don't you kick us off the park here a little bit, and let's talk about arthritis, but what is it?
Well, it comes, it's actually from, it's a Greek derivative. Arth means joint, and itis means inflammation.
So
it's very simple. When
people have this pain in their body, and if there's not an inflammatory reaction, then they got pain, but it's not arthritis.
Arthritis is it's one of those diagnoses. It's like dermatitis. You know, it's a rash of unknown origin. It's so we can put you in a box and give you some Advil.
You know, there's actually I said dozens, but there's really over 100 different forms of arthritis. If you get in and really look at it, and there's, you know, this type of arthritis, there's gout, there's psoriatic arthritis, and it goes on and on. But the most common form, and the one that we see most often, as most physicians around the country do, is something called osteoarthritis, or degenerative joint disease, and it's due to many different things, from trauma to joint. But, you know, one thing they say that I disagree with is that they say osteoarthritis, joint space arthritis, is due to aging. And it's not due to aging.
No, it's not.
You know, right as a 35-year-old, and you throw up their spinal x-rays, and you see massive degenerative condition, they're not old.
And I have this conversation with patients all the time. It's not a matter of linear time. It's not like, oh, it just, you know, that joint only had 20 years on it, and sorry, that's too bad. No, the DNA, the telomeres can turn over more times than you're going to live, and you're going to regenerate the joint. It's if you get injury or trauma in that joint, that's really, or there's the biochemical component. There's all sorts of different reasons. It's not linear time. It has nothing to do with age.
So it's What happens over time? It's during the timeline.
It's the timeline, yeah. It's that you live with an injury longer and longer and longer, and that's what causes the degeneration in the joint.
The interesting thing, too, is I've got patients who are in their 70s and 80s who have absolutely positively no arthritic anything in their body.
They're lucky. Obviously, they didn't get around the arthritis tree and they didn't catch it.
I know. It didn't work that way. So, but the thing is that there are people who are in their early years and have massive, massive degenerative changes.
It has nothing to do with age.
So let's talk about it a little bit. People can hurt without arthritis, and people can have arthritis and not hurt.
Obviously, the first thing you need to do is get some blood work done to evaluate your acetaminophen and aspirin levels, because if they're not high enough, you're going to get arthritis.
So you're saying that it's an aspirin deficiency?
Oh yeah, absolutely.
Is that what we're talking about?
That's why they treat it with it, isn't it?
I know it. That's why that's
got to be the answer.
That's
here,
right. Well, the drug companies say, here, take this thing.
That'll make it all better
for the rest of your life. So let's talk about
a little surly on the subject.
You think? 888-630-9625. That's 888-630-WMAL. Love to talk to you. We're talking about arthritis, and it's osteoarthritis is known as a wear and tear disease. It's one that can be due to a lot of different things. But the first thing that we have to get straight, and Dr. Poe brought about, is arthro means joint, itis is inflammation, so it's an inflammatory reaction of the joint spaces due to many things. And one of the most common things, and probably the most common, is degenerative trauma, if you will, or trauma that is presented in the light of inflammation.
Yeah.
So talk about that a little bit.
You get, we all have different injuries as we go through life. And when we have an injury to a joint, anything, if you don't go and you don't heal that joint, if you don't repair it, if you don't get those joint planes lined back up, because joints are designed to move in certain planes of motion. And when they get outside those planes, it starts to wear away at the cartilage, it starts to wear away at the joint space, and that's when you get that erosive osteoarthritis, where it's grinding down, it gets into the bone and it gets irritated, and that's when you start to finally feel the pain. But that can be years later. That's why, when we talk to patients, it's, what injuries have you had? Even going back, as a kid, what injuries did you have? Did you ever have any car accidents at all? You got to go back and look at all those things, because if you never got those injuries repaired, it's likely that those joints aren't moving the way they're supposed to move, and they're wearing and breaking down the joints even further.
We talk about subluxation in chiropractic. Subluxation is something where basically the vertebrae is out of position, and it's not moving in the normal plane that it should.
Right.
And there's a tremendous amount of irritation because of that. There's an inflammatory reaction. The nerves get stretched or tweaked or somehow inhibited a little bit, and now you got pain or loss of function. And over a period of time, the joint space, because of that abnormal movement, that abnormal relationship, begins to degenerate. And that's where you begin to see the arthrosis, if you will. Now with inflammation, you have itis and pain and heat and breakdown and immobility and loss of function. So take us through a couple examples of how this whole mechanism works. Somebody's in their early 20s, they're in their teens, and they have trauma.
You look at, the best example is, especially with kids today, much more competitive in athletics. And you really look at some of these teenagers, you've got to treat them, as if they were professional athletes, because they're very active in sports. You get a lot of sports injuries with kids. The same way with an adult. And it starts even earlier now is what we're seeing. So they get joints that get banged up, they get out of place. You get a kid that's a pitcher or a swimmer, and it starts to just irritate and tear up the joints. And you've got to look at that, and you've got to go back. You've got to put those joints back into place. You've got to move them back so they're nice and they're healthy again.
Traumatic wear and tear, muscle strain, force movements against joints that don't work is going to cause things to break down. And if we don't appreciate that, if we don't restore normal function, then the onset is arthritic degeneration, inflammatory joint disease over a period of many years. I've had arthritis. I have arthritic degeneration of my spine because of football, because of trauma, because of fights, because of all those things growing up, and then over a 10, 12-year period, a couple of very significant accidents. If it wasn't for the fact that my dietary patterns are really clean, the fact that I get treated with acupuncture, chiropractic, and the manual modalities that we use in our office on a regular basis, quite frankly, I wouldn't be moving.
There's certainly there's there is a biochemical component that goes with that. And arthritis really is part of that whole triad of health we talk about, the structure, the biochemistry, the stress. Because when you get that injury, if you don't have the biochemistry to support healing of the soft tissue supporting the joint, over time it gets worse, and it gets worse much faster. But it's the trauma that really, little things that we don't even notice, it's that trauma that really kickstarts the whole problem.
You know, a woman came in, I think this goes back probably about 5-6 weeks ago, a new patient came in the office, and she was complaining about her hands being numb. And they were, you know, that she couldn't lift anything anymore. She couldn't grab a hold of a cup the way she normally was accustomed to hanging. And she went in and they x-rayed her neck. And they x-rayed her shoulders, and they x-rayed her hands. And what they saw was this very progressive degenerative joint problem. But they ran rheumatoid factors on there, and they were negative. They ran the test for psoriatic arthritis, and they were negative. They ran, you know, the test for gout, and they were negative. So she ends up in my office because somebody referred her in, and bottom line is that the whole thing that caused this was the fact that her diet stinks, and the fact that she sleeps on her stomach with her head turned all the time, and she works in a job where she's constantly in the old days on a computer or on a typewriter, but today at her age she's on the computer like the rest of us with the mouse. So she comes in with pain. That's right. Common.
Yeah.
So when you see a patient,
you've got major trauma, but you've also got micro traumas. The little things we do over, you know, day in and day out. These little malpositions that we're stuck in front of the computer for 8 hours a day. You know, we complain about, you know, a long flight, a 2-3 hour flight. You know, we're stuck in the seat, but you know, people are stuck at their desk for 6, 7, 8 hours a day, just sitting in front of a computer typing, and it adds up over time. Or you're stuck in the car on the commute on, you know, 495. That can take hours.
You know, we're going to get in the next half. We're going to talk a little bit about treatment and whether this stuff is reversible. And I'll give you a little hint and said, yes, it is. There's so much that can be done but we're going to take this model and take it apart a little bit. But this Wednesday evening, the 14th of November, 7:30 p.m. at the Roselle Center for Healing, Dr. Leonard Poe will be your host, your presenter, on arthritic conditions, particularly structural-induced osteoarthritis, degenerative disease, whether you have it in your knees, whether you have it in your elbows, your hips, or your spine. This is a class that if you really like to see how to turn this nonsense around, how to make a difference, and really take control of your life and get yourself off of some of these crazy, crazy drugs with the side effects that, I mean, some of these arthritic drugs will kill you. They're not just something that's going to decrease the inflammatory response. They are going to actually take your life if you allow them to do that. And we're going to talk a little bit about that over the course of the show, and I know he's going to get into it a little bit in the program. But there are a lot of narcotics, everything from codeine and, you know, all the way down to, you can talk about Vicodin, which is
acetaminophen is one of the biggest causes for liver failure.
Right, and also heart failure.
Yeah.
You know, any kind of aspirin or aspirin
substitute.
Take
this stuff day in and day out for pain that is so easy to fix that it's a ridiculous model.
Yeah, the number one cause of hospital admission for liver failure is Tylenol.
Yeah. Period.
Tylenol. That's, you know, they try to sell it to you, but guess what? Take that thing long enough and you got a problem. Whether you're on Percocet or Tauin or morphine or, you know, any of the hydrocortisones for arthritic conditions, you are screwing up your
Just
life.
Fix the joint.
Fix the joint, restore the metabolism, get your body back the way it's supposed to, and beautiful things happen. And I've seen it over 36 years of practice, and with all of our doctors, it is significant in noting that this stuff can change. I want to go to the phone lines a little bit because there's somebody that's a little off topic, but I want to help them anyway. Tom, how can we help you, sir?
Yes, it's definitely a little bit off topic, but I appreciate taking the call.
Not a problem. That's why we're here.
My question is, my wife is pregnant. She's, I guess, about 10 or 11 weeks, and she's had really bad morning sickness to the point where she can't really keep down any food, and she is not eating meat because it just doesn't appeal to her right now. So I'm a little nervous because
how far along
I want
is she?
her to be getting the right nutrients.
Yeah. How far along is she?
I think she's almost done with the first trimester, about maybe 10 weeks at this point.
Okay, let me tell you one of the most effective. First of all, the diet's got to get really clean. You got to go to organic foods and try to alkalize the system. The reason women get sick is because the liver can't handle the breakdown of the excess hormones that are being produced at that time. And if that doesn't happen, or if the body doesn't break it down, then the inflammatory levels get high. One of the most dietary changes are really important. There are a lot of herbs that are very specific, which I'm not going to tell you because I don't know your wife's health. So I don't want you to just jump into it because they do have some interesting side effects if you take them at a way too high of a level. But acupuncture is one of the most effective methods of controlling nausea that I've ever come across, that we use constantly in our office, and I've used for 36 years. Makes a huge difference, Tom. So if we can help, help you.
Traditionally has kind of a weak stomach, so
yeah.
This has only made it 100 times worse.
Yeah, when you look at
that might be helpful.
Yeah, when we look at the acupuncture system, and you realize that all the channels are interconnected, and you have liver being affected by certain other organ systems and the like, you have to remember that the whole metabolism is shifted during this 9-month period. So if we can help you, Tom, appreciate it. Give us a call. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We are in studio, 888-630-9625. That's 888-630-WMAL. Love to talk to you. Any subject. We're talking about arthritis and what you can do about it. Your host, your presenter, this Wednesday evening at the Roselle Center for Healing, Dr. Leonard Poe. Join him. If you have any kind of arthritic condition, you want to find out if there's a way to change it, this is your opportunity. Give my office a call. It's 703-698-7117, 703-698-7117. I want you to remember that these classes are our gift, the Roselle Center for Healing's gift to you, so you can educate yourself, so you can find out what it is that you can do that makes a difference, that you can change your life, so you can get off some of the drugs that you've been taking maybe for a long time, particularly in these types of situations. But call us at 703-698-7117 this Wednesday, the 14th, at 7:30 p.m. Dr. Poe, one of the most common medications for years is something called Celebrex. And a couple, 3 years ago or so, they took it off the market. It was 500 milligram tablets. And the reason that they took it off the market was that there was an interesting side effect. It's called death, heart failure. And so they took it off for about a year.
One of those little things.
Yeah, one of those little things. But then they put it back on at 200 milligrams and 250, so they thought, well, that'll do it. It's not going to be so dangerous. Yet, when you look up the warnings, it says cardiovascular warnings. Quote, all prescription NSAIDs, that's any aspirin, like Celebrex, it just happens to be a greater aspirin, ibuprofen, naproxen, or meloxicam, all these guys carry cardiovascular warnings. They may all increase the chance of heart attack or stroke that can lead to death. I'm reading directly from their website. This chance increases if you have any risk factors associated with heart disease, such as high blood pressure, or if you've been taking other aspirin NSAIDs for any length of a period of time. Celebrex should not be used right before any type of vascular or heart types of surgery. It has problems with stomach. It has problems with intestinal tract. It has problems with the liver. Do you really want to take this stuff, or do you want to find out if there's another way to handle your arthritis? It's craziness. How often do we see this stuff?
This really is one of those that it's a broken model. It doesn't work. And you can, just take this stuff forever and ever and ever trying to just treat the symptomatology of the pain. You're never getting in there and really fixing the problem. And this is really one of those problems that's so easy to fix.
The interesting thing with any NSAID is that it competes in the joint space for the receptors that need sulfate ion. And sulfate is what allows your joints to heal. That's why we're out there buying glucosamine sulfate.
Well, it's a great model because, you can never get the joint to heal taking this crap, so you got to keep taking it forever and ever and ever.
It's
beautiful, isn't it?
It's a beautiful pharmaceutical marketing model. I mean, if you're invested in the drug companies and you have stock in them, you should be very happy because they are creating their own marketplace. It's a beautiful thing. It's a beautiful model. But degenerative disease goes hand in hand with this, and because it competes for the receptor site, your arthritis, your degeneration continues to worsen until the point where if it's your hip or your knee or your shoulder or your elbow, doc says, guess what? We're going to replace it.
Yeah. It's a great model.
So, do you want to buy stock in one of the companies?
I always feel bad for patients that come in and they've got pain and they've been taking aspirin, but I've been taking glucosamine. I've been taking, it's not been doing you any good.
No, you're throwing your money away.
Yeah, it's you're trying to do the right thing, and this is where the educational piece of this is so important. It's to really understand, because it's very simple stuff. Why the joint is not working the way it's supposed to, why it's giving you pain. You don't need to take all this other crap.
No, And, if you're not going to do anything else, there's things like coenzyme Q10 that you need to get into your body. There are things that you need
Which
to
is being blocked probably because of some of the other medications that you're on along with it.
That's right. Like, the corticosteroids, the ACE inhibitors, the methotrexates, the other aspirin that you're taking, and it goes on. You're wrecking your body. But I know you're going to get into it intimately. You're going to show them what it's all about, why it happens, and this Wednesday night, everybody, the 14th. Dr. Poe is going to get into the really behind the scenes, what happens, and more importantly, what you can do to be proactive in your own health.
And there's so many things. There's so many things you can do. I mean, simple things. It's a matter of getting it fixed, rehabbing the joint, changing a couple things with diet sometimes. It's simple, though. But you just got to get started on the right track.
There's questions that we have to ask ourselves, and the thing with it is that, arthritis pain can strike at any age. It's not something that is old age. There's a symptom process, and we ignore the symptoms. And so we stop doing things. We hurt a little bit, so we stop exercising. We hurt a little bit, so, we do those things that are comfort foods. We'll take things that blunt the pain because we buy into the model, what do you expect for your age? And as we get older, we think, well, it's really going to happen. And then we think, well, it might be rheumatoid. I have rheumatoid, and that's a death knell because your doctor says it never goes away, and you have to take things like methotrexate for the rest of your life. What really are the symptom problems, and can I do anything about it? And, is there an end product? Can we turn this thing around? We're going to answer all those questions on Wednesday night.
Bottom line is you can.
Yes, absolutely. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We're in studio. We're talking about arthritis, which is going to be the topic of our in-house presentation this Wednesday, November the 14th. At 7:30 p.m. at the office, Dr. Leonard Poe will be your host, your presenter. Those of you who know Dr. Poe knows that he always does an unbelievable job in giving you the nitty-gritty, the facts, if you will, on what takes place. Talking about arthritis today. Want to remind you, want to give you a heads up, want to encourage you. November the 27th. What's that? It's a Tuesday night, 8 o'clock. WETA, local WETA, W-E-T-A, PBS television, is going to be doing a 90-minute documentary on our work, Ageless Health. And we encourage you. We saw the finished version of it. It is amazing. It cameos 6 patients who've had tremendous health problems, who failed under normal medical care, including, by the way, patients with arthritic degeneration. And you're going to say, oh my gosh, this is possible. This is something that can happen. Put it on your calendar, 8 o'clock on Tuesday, November the 27th. And you're going to watch a 90-minute presentation on something that is going to open your eyes and hopefully change your life forever.
You'll enjoy it.
You'll enjoy it.
It was great. There's some patients on there with some really significant problems, and it's unbelievable their turnaround. But just normal everyday patients that have simple aches and pains and things.
Yep.
And the kind of things that we do, I mean, it's changed their life. They got it back. They can exercise. They can do the things they want to do. And it's not because they're special people, and this can happen to anybody.
No, one guy, a fireman who had degenerative low back pain, and nobody could help him, and he was turned around 100%. A young girl who has MS, another one who is a master level tennis player that couldn't hold on the racket anymore, had been every place and treated by every sports injury doc in the world, and she was able to turn around. It's a phenomenal presentation. It gives you the true representation of what can be done. So the 27th, make sure you watch it. Tell all your friends about it. 8 o'clock. Love to see you do it.
You'll want the DVD with the bonus material.
Yeah, the bonus material is very cool.
It's got my wife on it.
It does. I was very proud of her.
She's fantastic.
She
shows some exercises.
Yeah, she goes through. She shows you exercise. So you got to donate to WETA. You have to pledge. And it's one of those pledge shows. And get all the small little details as you go along, and she'll really, Erin she did a great job. She did a beautiful job.
I felt marvelous.
We're kind of prejudiced here, but she really is outstanding.
Just a little bit.
She really is over the top. Let's talk about arthritis coming up this Wednesday, the 14th, and you're going to do that presentation. And let's talk about foods. There are things that you need to stay away from. We get to my mantra, right? Sugar, sodas, coffee, teas, fast food, fried foods, alcohol, gluten, additives, preservatives. You stay away from that stuff, and the body doesn't get as inflamed. It doesn't break down. But there are also things that you need to put into your diet.
Yeah. Well, like I said, there is and this is, arthritis really is one of those good examples of the whole triad of health, because there is a biochemical component there that's important. There is a stress relationship important relative to the ligaments. But the diet makes a difference. You've got to get the inflammatory foods out. You've got to bring the level of inflammation down. You've got to get foods in that are going to support and help heal the soft tissue, because it's ultimately the soft tissue that keeps that joint in place, that keeps it from moving outside its joint plane again and causing the same kinds of problems that you started with. So if you don't change some of those things, you're going to get right back to the problem. It's going to be real easy to injure it again, and the pain will come back.
Natural anti-inflammatories are things like ginger and turmeric. If you even cook with those things, they can make a difference. But you want to eliminate certain foods. You've heard of the nightshades, things like tomatoes and peppers and potatoes and eggplant, and it kills me to get rid of them. But
it's not like you can never put those things back into diet.
But you can't do it every day.
You can't do it every day if you have those kinds of issues.
And then the polysaturated vegetable oils.
But there's ones that are,
you don't want to go anywhere near those.
Peanut butter, things like that.
Yeah, there's not a good thing.
But part of it is helping you to identify really what are these real inflammatory types of foods, so that you know in your everyday life, okay, these are the things I need to stay away from. So if you've got some options, it's, can you have some eggplant? Yeah, but you don't want to have it with a whole bunch of other nightshades and a whole bunch of, dairy and wheat and other things, because that inflammation is just, it builds and builds on itself.
Yeah, make sure that you drink, you eat a lot of vegetables, dark green vegetables, and make sure that they're fresh or slightly sautéed.
And water.
Flush that system out. Get all that garbage out, all the inflammatory reactions, and make sure your water is alkaline. Try to get as much alkaline anything and everything as you can into the body. The omega-3s are important. You can get it from wild salmon. Most Atlantic salmon, all Atlantic salmon, is farm-raised.
Yeah.
And the omega-6s are way too high, and that's going to actually cause you degenerative disease.
Right.
So you want to get the Alaskan salmon, the coho salmon.
These are the important little pieces. Yeah, I mean, it makes a difference where you're getting these foods from. Is it farm-raised or is it wild-caught? Same thing with your meats. Is it grain and corn-fed or is it grass-fed? Because that makes a big difference on, the level of the saturated fat. Is it leaning more towards omega-6s or towards omega-3s? It seems like we're nitpicky about things like that, but those are the things that you can actually control.
Well, things people don't understand. If you go out and you eat a piece of meat, and there's a lot of people listening to us that are vegans and vegetarian, I'm totally appreciative and supportive of their approach and their philosophical background if it's done properly. Vegan's not somebody who just eats bread and candy and sugars and macaroni and cheese and leaves everything alone. But people who do it the right way, it's a whole different ballgame. But people who are meat eaters, first of all, you shouldn't eat a lot of meat at one sitting. You have a little piece of meat, and you don't eat the meats that were corral raised and given corn and all that stuff, because the truth of it is they end up dying of the same diseases you're trying to prevent if they live long enough.
If they
have the heart disease and the diabetes and the fat stores and all of that nonsense, and they can't get away from that. So why do you think you can? It's impossible.
Yeah.
So you got to eat the right way.
You look at the health of the animal you're eating. That's a very important piece.
Pretty much.
The same thing with vegetables too. What's the health of those vegetables? But I mean, those are the things that go into really fixing a problem and really getting health back. Whether we're talking about joint destruction or anything else. I mean, those are the little things that really matter.
So if a patient really has arthritis, Dr. Poe, and we've said that pain in the joint spaces is not necessarily arthritis. It can be a pinched nerve. It can be
lots of things.
Yeah, muscle that's not working properly.
And you got to differentiate it. And I always get patients that come in and I have arthritis. My first question is, well, what kind? There's lots of different kinds.
Yeah, pick your favorite one.
Is it an autoimmune type of one, like psoriatic or rheumatoid or gout? Is it one of these other metabolic disorders,
which is reversible, by the way?
Which is, or is it just simple joint trauma? And we just need to correct the joint and then heal the tissue. And there's a big difference between the two, but they're both correctable. That's the thing.
If you have a joint that's not functioning properly, if it starts from your feet up, or if it starts from your spine down, if it starts because you took a trauma or a blow to your hip or a muscle that's not communicating properly, until that's stabilized, you got a problem.
Exactly. And, because it's my knee that hurts. Well, the problem might be in your foot, or the problem might be in your hip or low back. You've got to see, well, why is that joint not working the way it's supposed to, and why is it grinding down, and why are you getting the pain? You might have to fix other things.
The other day a guy came in, matter of fact, with a knee problem. He's sitting on the examination table, and I had him raise his knee, not straight out. I said, bring your knee up with the leg bent, and I stabilized his shoulder, and I pushed down the knee. He couldn't hold the right side. The left side, he had more stability. The right side knee was the problem, but I was testing the hip flexor. It's a two-joint knee. Or two-joint knee. Yeah.
Slow down.
Slow down.
We get excited.
Yes, we do sometimes. It's a muscle that goes over two joints. And so I tested the muscle, and it didn't hold. And then all I did was I took and lifted his spine into a kyphotic pattern. I had him arch back and lift it up a little bit and retested the knee, and all of a sudden the knee was as strong as the other one on testing the hip flexor. And the guy looked at me and he said, "How did that happen?" I said, "I fixed temporarily for the moment the joint that's giving you weakness in that muscle that's causing your knee not to be stable, and also your hip. And by the way, have you had hip pain?" He said, "Yeah, when I go upstairs."
Yeah.
Case resolved. But now you got to treat it.
Yeah.
And we know that in acupuncture that every muscle has a relationship to the organ systems, and that organ, by the way, has to be the small intestine. So kind of an interesting twix. So when you see a patient like that with an arthritic condition, how do you take it through? What's the evaluation process?
Oh, well, first is the history, looking at the trauma, looking at all those different pieces. I mean, you've got it. Well, when did it start? When did this first time you've ever had any kind of pain like this? Did you ever have any kind of injury there? Those sorts of things. And then looking also to the other joints that are supportive to it. Like you said, with a knee, you got to look at the hip, you got to look at the low back, you've got to look at the ankle and the mortise joint and the foot. You've got to look at all those different pieces to really find out, well, what's driving this joint problem? And then looking at the metabolism, looking at diet, because all those things make a difference. And stress, we kind of stayed away from stress, but stress factors into the ligament system and how well it supports, and ultimately it's ligaments that hold bone to bone. And they get overstretched and they don't respond the way they're supposed to because we're under constant amounts of stress.
You know, a while back, 2011, there was an article that was published, and they quoted this guy by the name of John Clappel. He's a medical physician who is president and CEO of the Arthritis Foundation. And statements like this make me nuts, because they said, what symptoms should I look for, and so forth and so on. And it says, going back, and I'm paraphrasing the article, and it said that many people assume that arthritis pain is just part of getting old, which we were saying it's not, right? So that part I agree with. And then they go, if you have a joint space that hurts for more than 2 weeks, if there's any swelling whatsoever for more than 2 weeks, you've got arthritis. Will you give me a break already? I mean, how can you diagnose arthritis just because you have a little swelling in the joint? It can be a ligament, it can be a disc space, it can be cartilage, it can be, and, Because
the treatment's the same. I just need the diagnosis to put you in a box so I can give you a drug.
Yeah, so I can give you a steroid, or I can give you whatever.
It doesn't really matter what's wrong with you. We're
take these steroids for 5 days and come back next week and let me know if it does any good. Arthritic conditions can be turned around. They can be changed.
Absolutely.
888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject you have in mind. We're talking about arthritis, and if you'd like to talk to us off the air, all you have to do is go to rosellecare.com. That's ROSELLECARE.com, or go to drtomroselle.com, and we've got a great site there for you to learn all kinds of things. But right now, for this program, we want you to attend a presentation if you have arthritis, if you've been told you have arthritis, if you're on medication that's messing you up in other ways, that's causing your health to go down the tubes, that you may suffer a heart attack because of the medication that you're taking, this is an opportunity for you to come and find out what you can do about it and change it tomorrow, the next day, immediately. 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to attend this Wednesday's presentation on arthritis. Dr. Poe will be the guy that's going to talk to you, and he'll be there to answer all of your questions. Listen, don't put up with it. Don't believe the nonsense that's being fed to you, and you're being spoon-fed. It's like, who's drinking the Kool-Aid out there? It's craziness. Fifth Avenue marketing is amazing. This is a subject that gets me hot simply because for 36 years of my clinical practice, I see patients come in all the time with this diagnosis, even when there's no joint space damage. When there's no joint space damage, they come in and we can show you how it can be fixed without all the garbage that they're putting in your body and the degenerate, providing that you want to.
Yeah, that's the thing. You've got to want to make some changes, and you've got to want to get this thing fixed.
So what do you do? Where do you start? What would you tell the patient?
With what?
With arthritis, the question we're talking about.
As far as treatment goes, or finding out what the problem is?
Yes. Let's talk about finding out what the problem is.
It's like we talked about. You got to really get to the root of it, and is there actual joint damage there? Is there inflammatory condition, or is it just muscle dysfunction? Is it coming from somewhere else? Really, the why behind it that we always talk about. Why is that? That's the most important piece. But then the treatment, it's, you open up the joint space, you fix the muscles, you fix the soft tissue, you get it healed, you change some things with diet relative to inflammation, you get the stress level adapted again so the ligaments are nice and strong. All that stuff's very easy to do. This is not a complex, complicated subject. I mean, this is very simple stuff.
It really is.
Or you can take drugs the rest of your life.
Yeah, I mean, your choice. If you like
surgery.
If you like the medication, you have to help, support the companies that, that you're investing in. They really have to.
Just let me know so I know if I need to buy stock.
I know. I trade. I don't even invest anymore. I get in and out of the market. So if you're going to buy a whole bunch of stuff, let me know when you and your friends are going for your next prescription, and then we can do something about it.
All kidding aside, this is something that it affects millions of Americans, and it just shouldn't. It's something that is resolvable. You just need to know where to start.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We're here every Sunday at 12 o'clock, bringing you the most intimate and updated information on integrative care. I want to remind you again, November the 27th, WIDA is doing a 90-minute documentary on our work. Put it on your calendar, tell all your friends about it, and I think you're going to be impressed. We've seen the finished product, and it's amazing. I didn't think that, it could be so good, but it was. And you're in it. Never mind. I'm not going to go to that place. But seriously, it's a great program, the 27th. And this Wednesday evening, the 14th, 7:30 p.m. at the Roselle Center for Healing, Dr. Leonard Poe will be your presenter. We're talking about arthritis and degenerative disease, what you can do to turn it around, that there is, in fact, a resolution. Call our office at 703-698-7117. That's 703-698-7117. Love to have you. We do require a reservation because the classes fill up. Particularly a topic like this is one that is unfortunately affecting many, many patients and people are going to want to know. So call us, 703-698-7117. Diane, how can I help you?
Yes, hello. I have a lot of pain in my right knee. Years ago, I had a torn meniscus operated on. Everything was okay, but for the last number of months, I now have been dragging my leg, limping. It hurts in the right groin as well. And he said I've lost cartilage and the bones are, rubbing against each other. The joints are rubbing against each other. He wants to always give me cortisone shots, but I refuse to take any of those.
Good for you, because it'll make it worse. Cortisone actually causes the joint space to advance much more rapidly relative to degenerative change. And so what you need to know about this, I'm going to try to answer very quickly because we don't have a lot of time.
Is there anything I can do?
Yes. If there's no bone on bone, and it doesn't sound like there is, the joint space, first you have to understand, we have to understand whether the pelvis is balanced, whether the nerves from the spine are working the way they're supposed to, whether the foot pedal base is off, the dietary patterns that are associated with it. Once we get an idea of that, then treatment, as we've done for thousands of people over the years, can be directed specifically to, one, stop the progression, two, begin to balance the joint spaces, and then begin to resolve as much as possible. 100%, it depends on how bad the condition is. But I can tell you this, unless there's bone on bone, where there's nothing left, you're wearing one joint space against the other, as long as there's some space left in there, the body can begin to produce some results that can, one, get rid of your pain, and two, begin to give you some stability and give you some life back in that joint, if you will.
And it sure doesn't progress into being a hip problem, being a low back, because that's what's going to happen.
Yeah, she's getting joint pain now, and unfortunately,
that's why it's starting to injure the groin and irritate it.
That's right. Yeah. And the more that happens, and you get the crunching and the crackling and the grinding and so forth, that's the beginning stages where it's starting to break down.
That's why you see them with weight-bearing joints more often.
Yeah, not a good thing, but it can be helped.
Absolutely.
The process is one that we've seen very, very effective, and it depends on your willingness to step up, do the things that you need to do, and put it together. What happens is a retracing, but I wish we can get into it a lot more. But Dr. Poe will this Wednesday evening, 7:30 p.m. at the Roselle Center for Healing. Give us a call, Diane, at 703-698-7117. Attend the lecture. We'll be happy to talk to you more intimately. We're here every Sunday at 12 noon, as we will be next Sunday, bringing you the best information possible. See you then. See you this Wednesday. This is Dr. Tom Roselle.
Did you know that breast cancer is on the rise and that routine annual mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? The result could increase the risk of developing breast cancer.
Now, consider a simple, non-invasive, and totally safe adjunct medical procedure approved by the FDA, which can detect evidence of breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect initial signs of breast cancer, such as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call Thermography Centers at 888-485-7736. That's 888-485-7736. And for more information, visit thermographycenters.com.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and include a thermographic breast scan as part of your annual wellness checkup.